The dual rinse was developed by Professor Matthias Zellner, an endodontist and lecturer from Zurich, who has had a single obsession for years: to facilitate the irrigation and disinfection protocol in endodontics. As often happens, it is in an already existing product, but intended for other uses, that he found the solution to a problem that many wanted to solve: having a single solution with two effects, disinfecting and chelating. This is how dual rinse was born. Perhaps you have heard of it, but do you know exactly what it is? To celebrate this 100th expert response, it is with great pleasure that I will discuss with you this solution that many consider to be magical. We all know that to properly clean a canal, it is necessary to use two solutions: a disinfecting solution, sodium hypochlorite, and a chelating solution that helps eliminate the smear layer by dissolving the mineral component that constitutes it. ETA and citric acid are two solutions that they commonly expect to use before dancing to dissolve that drop of antimatter. A major drawback of using these solutions is that they do not mix well with sodium hypochlorite at all. They are, however, intended to be used in the same confined space, canal, but it is certainly not advisable to mix them. To do it properly, one must aspirate the contents of the canal before applying the next solution, a tedious and time-consuming procedure that often leads to the abandonment of the use of chelating solutions in the protocol. And that's a shame. It is then that dual rinse, the commercial name of a solution known as HEDP, becomes interesting. By mixing this HEDP curve into the solution of the inference, it will act as a chelator without interfering with sodium hypochlorite. Finally, an ideal solution. But what is it exactly? I suggest we approach this product by answering 6 questions. The first question is, what does HEDP mean? HEDP is the abbreviation for 1-hydroxyethane 1,1-bisphosphonate. It is also known as ethydronic acid or simply ethydronate. It is a chemical compound belonging to the class of bisphosphonates. As it turns out, we can expect anything. Bisphosphonates are finally making their way into endurance. Second question, why is HEDP used outside of the prescription? Glyphosphonate are medications primarily used to treat bone disorders, as you know, particularly osteoporosis. Ethydronate acts by minimizing bone resorption and allows for the maintenance or even increase of bone density. It is therefore used in the treatment of certain systemic diseases, such as Faguet's disease or other bone metabolism disorders. Apart from biological treatment, HEDP is also found in household products, particularly in descaling agents. And you are probably using HEDP in your dishwasher, in the capsules, without knowing it. Third question, in endodontics, what is its interest? Well, HEDP is primarily used as a chelating agent. By eliminating the mineral part of the dental mud, it helps to improve the disinfection of the canal system, but in an indirect way, HEDP does not have an intrinsically disinfecting effect directly. So, how does it work? Well, it is a chelator that binds calcium and other divalent ions. The acid is ionic, having the ability to bind to the calcium ions present in hydroxyapatite. This bond leads to the dissolution of mineral crystals, thereby facilitating the cleaning of dentin and canal surfaces, which will then be sanitized by the sodium hypochlorite solution. When ethydronic acid is used in combination with sodium hypochlorite, it prevents the formation of undesirable precipitates, such as calcium oxalate precipitates. This property is particularly useful in endodontics as it maintains the clarity of the canal systems and, above all, prevents blockages. Ethydronic acid is less aggressive than DTH, which allows it to be used in conjunction with disinfectant solutions without reducing their effectiveness. So does it interfere with sodium hypochlorite? One of the weaknesses of the ODPR is its interaction with sodium hypochlorite, and this occurs immediately after the two solutions come into contact. This can sometimes result in a fairly strong exothermic reaction. Therefore, the two solutions should not be mixed in the canal. The canal must be emptied of its contents before filling it with the next solution. And repeat this several times. With HEDP, the reaction with sodium hypochlorite is possible, but not immediate. After 1 hour, the sodium hypochlorite begins to react with HEDP. Therefore, the dual rim solution will always be prepared at the time of treatment and not in advance. It is therefore recommended to use the solution for one treatment and to replace it with another solution for subsequent treatments. On the other hand, it is interesting to note that by decreasing the concentration of the degassing solution to 3% or less, the reaction between sodium hypochlorite and HEDP is very limited. Or delay it. If kept cool, This solution can even be stored for a workday. In this case, it is advisable to prepare several syringes at the beginning of the day, store them in the refrigerator, and use them as needed. What happens between HEDP and calcium hydroxide? Well, there is no risk. The more alkaline the environment, the better the stability of HEDP, which also binds very easily with calcium. In the presence of HEDP, calcium hydroxide ions are more easily released from calcium hydroxide in aqueous suspension, thereby optimizing its effectiveness. Can HEDP be used for the revitalization technique? In the protocol you may be familiar with, the solution it requires is used at 2 stages of the process. During the first surgical session, it is used to clean the dental surface, eliminate any smear layers that may have deposited on the walls, and to open the dentinal tubules in order to optimize the penetration of the intracanal medication that will be placed between the 2 sessions. The second phase of using what it achieves in this protocol is applied at the moment when revitalization is to be performed, just before the clot formation procedure. The objective at this stage is to induce controlled demineralization of the surface, thereby allowing for the marking of growth lines and other matrix proteins of the dentin. These matrix proteins will remain on the surface and react with the blood clot. Until now, the EDTA solution has been commonly used. Therefore, it is wise to question the relevance of using the HEDP solution since it is less aggressive but equally effective in this protocol. It is generally advised to dilute the HEDP solution not in sodium hypochlorite but in sterile water. Many publications clearly demonstrate the uselessness of leaving a sodium hypochlorite solution in the revitalization protocol. But if you still have doubts, you can dissolve HEDP in sterile water. Technically, how is Duarin used? Duarin comes in the form of a white powder contained in a typical medication capsule. Each capsule contains 900 mg of powder that will be diluted in 10 ml of a sodium hypochlorite solution. The dissolution is not instantaneous and may take 4 to 5 minutes. The protocol is simple. Just pour the equivalent of 1 capsule into a metallic container, a small cup, and refill it with 10 ml of sodium hypochlorite. Mix with a spatula to harmonize the solution for a few seconds, and then wait for the dissolution process to occur on its own. In 4 or 5 minutes, the solution is completely dissolved in the epic solution, which then becomes transparent. Next, the mixed solution is used throughout the canal treatment in continuous irrigation and for the final irrigation protocol. Instead of using 2 solutions alternately, sodium hypochlorite and EDTA hypochlorite, only 1 mixed solution will be used throughout the entire signaling protocol. The solution can be activated in the canals with any agitator, even with a hyperbiological laser. There are no instructions. By using a single solution, the final irrigation protocol is simplified. It takes only 2 or 3 minutes instead of the 9 minutes required when using 2 solutions. So, in conclusion, let us remember that there is no miracle solution or product in medicine or dentistry. Nevertheless, there are some that bring improvements sometimes in biological efficacy, and sometimes in the facilitation of usage protocols. The CDP is marketed under the name Dual Risk by the company Medsum and is undeniably part of it. The use of 1 or 2 capsules for treatment both facilitates the operative protocol and improves canal disinfection. Numerous studies clearly demonstrate the effects of this solution. There you go! I was delighted to celebrate with you this 100 expert responses, and rest assured, this is not the last one. See you very soon.